Hello everyone, welcome back to my channel, The Courageous Walk. I am Jonelle Reynolds, and today I'd like to introduce you all to Dr. Angela Richard-Eaglin. Today we're going to be talking about infertility and postpartum depression. So welcome, Angela. Before we jump into the main discussion, tell us a little bit about who you are.
So, as you said, who I am, I have a doctorate in nursing practice. I've been a nurse for 26 years. I've been a family nurse practitioner, board certified for 19 years now. And I teach at Duke University in the School of Nursing. I teach nurse practitioner students. And my practice has been vast. I've done women's health, family practice, urgent care. Mostly I've worked with vulnerable and underserved populations. God, I've done so many things I can't even think, but lots of it has been in leadership. I love family practice nursing, but women's health will always be a passion of mine.
Excellent. So to jump right in, because I have a personal question, as a woman in her late 30s who is single and not actively trying to become pregnant right now, there's just a lot of pressure out there to, think about my eggs and will they be viable when I finally have a partner and that becomes part of my family planning. One thing on my agenda is potentially freezing my eggs.
Mm-hmm.
That's recommended so that it takes some of the pressure off. But what should women my age group who are in their late 30s or in their 30s in general, maybe in their 40s, who would like to have children, but they don't have a partner just yet to make that a reality if that's, they want to have children within the confines of a relationship. What should we be thinking about at this point?
So you were correct in terms of freezing your eggs because, of course, with age, not only the number, but the viability does decrease. So I would make reaching out to a fertility specialist a priority. You could start with your OBGYN, but of course, you're going to need to start the process of that, and it does involve several steps. So I would definitely not wait to have that conversation. And oftentimes women may wait because the reality of that, is kind of difficult to deal with sometimes. But if you know that that's what you want, then you definitely need to get that process started.
Absolutely. So for those who they don't have the finances, right? Because once you get the eggs, you have to pay for it, or don't have access to the type of health care and health insurance that would free them up to do that. Like, what are some of the things they should be thinking about if that's not an option?
So you would start with a family planning. A physician, usually an OBGYN, can help you with the family planning, and you could try some of the less expensive methods because freezing of eggs and getting in vitro and all the fertility treatments can get quite expensive. So start with your OBGYN and see what your options are.
Yeah. Okay. And so since the focus is on infertility, particularly for, women out there who are actively trying to get pregnant and it's not happening, perhaps you could walk us through your own story that could be an encouragement to other women who are currently there.
So in general, for a year of trying with no contraception, you haven't gotten pregnant, then you're pretty much, you can consider yourself having some fertility issues, and you would definitely want to seek out some help with your OBGYN, just for in general, just knowing that, and that's at any age. So for me personally, so my husband is my high school sweetheart, and when we got married, I was 25 years old. You plan your life and you think everything's just going to be grand. My husband was in the military while I was in college, and we were separated from time in terms of geographically. And so I've never used contraceptives. I'm like, okay, here I am. I'm not having sex, so I should be okay, And we got married. We still didn't use anything, and I wasn't getting pregnant. And of course, everybody on both sides of the family, friends, everybody's like, when are y'all gonna have a baby? You've been together forever. When are you gonna have a baby? Well, I thought it was just going to happen. So my plan was at 27. I just want to have a baby at 27. And I never went to do anything about it to fast forward through this story. Well, I need to back up. So the other thing is make sure you find a physician who is compassionate and has some sensitivity toward what you're experiencing. Because I actually did go to a female OBGYN who one of my friends suggested would be great, you know. And I went to her and she just seemed very disconnected, disinterested, and that made me feel some type of way. Because when you're going through these fertility issues, for some reason we want to blame ourselves, like it must be something wrong with me. And so it's hard to really approach that. And I need to make sure you know how important that is, because even though you're feeling that way, you need to talk to someone. So it's important to find a provider that you connect with. So even if it's not a physician, we have women's health nurse practitioners, nurse midwives who are qualified to do a lot of those things. So that's number one. Because after that experience, I didn't go back to one. Now I am a healthcare provider, yes I am, but I was like, I'm not putting myself through that mentally again, you know, and I would not talk to a whole lot of people about it. So just know that if you're going through that, that's kind of normal too.
Mm-hmm.
Someone like in my circle said, I'm having problems getting pregnant. I'm trying. I'm like, oh, me too. You know what I mean? Because again, like I said, I had this shame going for some strange reason, I don't know. But I happened to be a student. I had gone back to school to become a nurse practitioner. So my husband and I had been discussing this all along. And there's a lot of pressure on that husband too. When you want a baby, you want a baby, right? And so you do. You put them through some stuff. I'm ovulating this time, you know what I mean? So and it becomes a business transaction because as a female, you want that baby so badly. And we are Christian people. And so I used to make him pray. I'm like, you know, they say when two or more gather in his name. So let's gather, let's pray. Like I cried a lot. And then the semester before my final semester of school, I said, well, after I finish NP school, we can go ahead and start the fertility treatment. And just by a miracle, which the physician even told me that this is a miracle, I got pregnant that semester, and I was 30 years old at the time, and I had my daughter when I was 31. And it was quite a journey, and it was quite a pleasant surprise to have that happen. And we talked about, I wanted kids so bad. I was going to adopt if I wasn't able to have a biological, but I used to pray to God, let me have at least one, please. So it was difficult. There are some other things that made it even more difficult because at the time I was working in labor and delivery in a federally funded hospital, and I saw people with less than ideal circumstances, like teenagers. Youngest patient I saw, she delivered on her 12th birthday. And people on crack, a lot of drug users coming in, having multiple premature babies. And I was just like, what did I do wrong, God? Why are you punishing me? You know, what did I do? Because I can give this baby a good life. So I struggled even through that in silence. Like so many times when I would hear those babies cry, it took all I had not to cry, because I'm like, will I ever hear that sound for myself? Yeah. So it's a lot emotionally, and that's the point I'm trying to get at. Like the thoughts and the blaming yourself is really, really bad. And I have friends who ended up divorced. We have to bring that through too, because they put so much pressure on the husband, and then some blamed the husband, like got angry. It's your fault I can't have kids, you know, like just. So it's a lot. That's the point I'm trying to make. But
yes, I think when we're going through difficult times, especially for things that we don't have control over, it's a lot easier to try to blame someone. We either blame ourselves or we blame other people. And sometimes it's both partners. Sometimes infertility has to do more with the husband or you know, the partner or yourself. But regardless of what a doctor says, it's not going to stop the woman from blaming herself and feeling less than, because in many circles, you know, your womanhood is attached to being able to give birth, right? To be pregnant, to be able to give birth. And I think also, like you were saying, in your 20s, there was this pressure of, well, I have a timeline, because we all have a plan of, you know,
Mhm.
the ideal, and then other things happen. So can you tell me a little bit more about the last semester when you were not focusing on getting pregnant? You were trying to graduate and you got pregnant. Was there something to that?
So yes, and before I go into that, I will say also for men, it's a test of their manhood because, you know, my husband told me about my cousin, who's the one who made a comment to him about, you know what I mean? So that's another added pressure and stress in that relationship, especially I think if the relationship's not strong, you know?
Right.
So now that I put that out there, but that's true. So when you're stressed out and focused on it, and I've heard a lot of people say that, and I didn't think that would be the case for me, but when you stop thinking about it, it actually, that's when it happened to me. And I don't know that it was because of that, but I do know that stress, of course, on your body affects so many things, like that mental thing. I often tell my patients when you see those commercials that say depression hurts. Well, it's true. Mental things manifest into physical symptoms. So yes, you do have to zen out and
Yeah.
chill out and stop focusing so much on it. It's kind of, I mean, I can't say that if you just pray about it and all this, it'll go away. Of course, you want to pray, but you also need to seek some medical help. And I just was one of the blessed ones. I was going to say lucky, but blessed for sure that I didn't end up having to go and do the fertility treatments.
Yes.
I've only had one child, so that's also a testament to there is something, and I don't want to use the word wrong, but there is something that's not right either with my body, my husband's, or both. That we had this one child and it never happened again, because I didn't mention that either.
Yeah.
After I had my daughter, I did want to get on birth control, and my doctor, I absolutely love this man. He is like truly an angel on earth. He, I asked him, I was like, I don't want to have another baby. You know, like sometimes that happens right after you give birth, you're fertile, so you get pregnant again. I'm like, I don't want that. He said, well, I'm not giving you birth control. And I respect him. I'm going to tell you why, because he said, I'd rather you be in here in 9 months delivering again and angry with me because you're having another baby back to back than you want another one. And you can't, because now we've given you something your body has never had before. And
Right.
it can cause some extra problems. And I didn't do any testing to see what the problems were beyond getting some blood work drawn. But I didn't do any of the in-depth stuff.
Right.
So just, I know that there was still, because you have primary infertility, which is if you've never been pregnant before and you're having trouble. And then secondary, you've had a baby and now you're having difficulty having another one.
So
So
there
I'm
were two kinds? I didn't know that there was
correct.
primary and secondary.
Yes. So I would put myself in the category of both because I had that problem for all that time. And then I had my child and again, never got on birth control afterward and never got pregnant again.
Wow. So I do know that for some women, their fertility issues manifest in miscarriages, right? So there's a lot of women who get pregnant, but it's difficult for them to stay pregnant.
Yeah.
And I feel that's an additional trauma because, you know, after the first loss, it's like, well, do I even allow myself to bond with this baby, knowing that I might lose this baby again, right?
Yeah, I'm so happy you brought that up as well. So during my journey, when I was silent about it, again, it's so many women. That's the other thing. Like you have no idea like how common this is with people in your own circle who just aren't telling you. So there was a nurse that I worked with who was having some issues and then she got pregnant and she had a miscarriage, I think twice.
Wow.
She said something. We were having a discussion and we were close enough where I could be open. So what I said to her, this is when I opened up to her about having problems. I said, well, at least you know you can get pregnant. And I know it's traumatic. I'm not taking that away. Trust me, I would hate to get pregnant and then get my hopes all up and then lose it. I said, but imagine, I don't even know if I can even ever get pregnant. And she's like, I hadn't even thought of that. So just having someone that you're close enough to, and it's not minimizing a miscarriage at all, because trust me, I would have been horrified if that had happened to me. And I was there. Like, she called me for one of them in the middle of the night when she started bleeding, and she's like, I think I'm having a miscarriage. And of course, I'm answering my phone for her because we had that bond, and it was horrific to go through that. Even I felt her pain, like, really. She has a child now too, thank goodness. I don't know, but thank God that she was able to have that one child as well. But yeah, that is also very common. I have another friend who had, I want to say, 6 miscarriages in 5 years.
Wow.
She since has had kids, but still, just, it can be very traumatic. I have friends who have spent thousands on the fertility treatments and lost the baby.
So there, even if you're doing the fertility treatments, there's still no guarantee that your body will not reject the child.
Correct. And I mean, I have faith in fertility specialists. They get your body in prime condition to the degree that they can.
Right.
So there's no guarantee, and you just have to know how much of a financial commitment you're willing to make. I know people who have spent up to in the 70s to hundreds of thousands of dollars trying to get pregnant, and these aren't rich people. And for myself, I had talked to my husband about that, having had friends who did it, to see how much of an investment we were willing to make. And in my head, and he was on board with that, I was like, up to $100,000. And of course, you don't spend all that right away. I'm not familiar with how much it costs now. It was like $1,000 each round of, and that's some of that early stuff, okay? Because it can get more expensive, but I was willing to spend up to $100,000. And I was like, I'll pay on it just like you pay a house note or something like that, because there are those things. I was like, I'll get a loan, whatever I need to do. But I just wanted a biological child just that bad.
Yes, yes, yes. So what advice would you give to women who are in the process of trying to get pregnant, right? It could, some of them, they're in the early stages, nothing's happening, or, you know, a year has gone by or 2 and they're still trying. They haven't quite yet gotten to the stage where they're talking to a fertility specialist.
Mm-hmm.
Like, what are some of the tips you'd have to help them sort of emotionally to stay strong and not just, you know, just be consumed by the pressure?
Yeah. So a couple of things. Ideally, when you know you want to start, so your body's at its prime as a woman at age 25. That's the optimum for your body in terms of being ready to hold a pregnancy. And there are several things you can do to prepare your body. Of course, you want to stop whatever contraception you're using. Just make sure you're eating a healthy diet, trying to keep your mind, body, and spirit fit, pretty much. And just find a balance for sure. And then also, it's very wise to go and start talking to an OBGYN if you know that you're wanting to start that process, because there are some things that you can do, such as the blood work, and see what your hormone levels are. They can do simple things like ultrasounds, non-invasive things to see what your eggs are looking like, and ovulation tests. And then the male can go, of course, and get tested what the sperm count is. And just both people should be going and seeking some kind of medical advice, ideally.
Yes.
Then if you don't do that, you could be like I did, right? And I didn't go for a long time. And so I almost forgot part of your question, but if a year or 2 has passed, definitely you want to go seek out some help. Mm-hmm. And I hope me making myself vulnerable by speaking to it is emphasizing that you're not alone. If you feel like you're embarrassed or whatever, those feelings are not going to contribute to what your goal is, which is to get pregnant. So you don't want that to hinder you from the process. And the more time you wait, of course, your eggs do start to age. So you don't want to do that. You know, just think about, what is my end goal? So I need to suppress some of that. And even if you need to go get therapy, I think that's also very important if you're going through it, for the couple to go and get therapy.
Absolutely. I would recommend going. And there are some clinicians who focus specifically on fertility issues that can really walk you through that process because, right, it's a financial commitment, it's an emotional commitment. If the relationship, because you don't have to be married, but if the relationship is not on solid foundation, this type of stress can break it.
For
So
sure.
so in addition to going to the medical doctors to get tests to see where your body is at, your starting point, I would also start talking to a clinician that specializes in this area to also make sure that you as an individual, both of you, both partners, individually are in a place. Because, right, the other thing that comes up too, trauma manifests itself in various ways. And just the act of trying to get pregnant, not having a baby, all of those things can bring up past traumas. So for women who've had abortions in the past, those traumas will come to the forefront if you're now trying to have a baby and it's not working. Those who've had any other kind of like family traumas, especially around babies and pregnancy, all of that will come back to the forefront. So you're not just going to be facing the current stressors of trying to get pregnant, but things from your past, especially if you have not worked through them, are going to manifest. And that just makes it hard on your body, especially, you know, you need to be as calm and trying to cultivate, like you said, mind, soul, and body, where the baby can just thrive. What about those women? Like, at what point should a woman start to consider maybe I should look at alternatives?
So that would be an individual choice for sure. Like I said, for me, even the other thing that my husband and I had talked about was after we had a baby. And I said that because ideally I wanted 3 kids, is what I thought I wanted. Like you said, we plan our lives. And we'll get into that conversation of why that didn't happen. But I said I would adopt at least one more or maybe 2 more. But I never got to well, when I did get to the mental state where I felt like I could have another baby, I just didn't do it. And by the time I thought about it, I'm like, I'm too old. I don't know, too many different things, different variables in my life that changed that. The other thing I didn't mention too is if you know you want to get pregnant, you also should start taking folic acid supplements because it helps with so much in terms of prepping your body again for getting pregnant. And even while you're pregnant, of course, there's a folic acid requirement, but you can start doing that ahead of time. You can also start taking prenatal vitamins even when you're not pregnant because, of course, they have all the right amounts of all the vitamins and minerals you need. So start taking those before you're pregnant as well. But alternatives, if it doesn't happen, you do want to talk with your partner about adoption. If you don't have a partner, you don't need a partner to adopt the baby, right? Because there are so many babies out there who could use us. And, you know, women who, that's the other thing. So you mentioned abortion and things historically. There are who have put their first child up for adoption because they weren't ready for whatever reason.
That too. Mm-hmm.
So then you start to blame yourself even in terms of that. So the point I think we're both making is how important therapy is. Like, you don't want to wait because those feelings will not go away. They're going to get worse if you don't go and work through them. And I keep saying OBGYN, but I don't want to discount what I do either because I am a healthcare provider. A lot of people don't know the role of what advanced practice nursing is. So nurse practitioners, nurse midwives, and I'm family. Like I said, we have women's health. We're qualified to do so much of what medical doctors do. We do a whole lot of the same things. We're not physicians extenders. We're not that. We're not mid-level practitioners. We can open our own businesses and you can look us up. We have statistically, we have great stats in terms of the care we provide and the outcomes, which is the most important when you see a nurse practitioner or an advanced practice nurse, because we bring that nursing and heavy healthcare education side to that practice side. So I think that's the beauty of it. Of course, I'm going to be biased toward my.
That's okay.
Yes.